Human Services Board meeting to order. At this time, if I could have the clerk, Jules, if you would take the attendance, please. Roll call.
Of course. Hi, everybody. Joel Baraka, Paula Holdick.
Here.
Robert Kopish is excused. Patricia Stephen.
Here.
Dennis Wargo.
Here.
Nicole Kolwicki is excused. Sally Hummel. Stacy Pomeroy.
She's not here yet.
Okay. We will leave it there. And Gerald Swenson.
Here.
Right.
Okay. Welcome here, everyone. Oh, there she is. Maybe. Oh, I thought that was her. Okay, so at this time, I'm sorry for the lapse there. Are there any public comment from anyone in the gallery? Seeing and hearing none. How about online? I only see, well, there's one caller in. Nobody there, Nick? No? Okay. Any communications from our board? No? All right, well, then we'll move on. Let's move on to the vouchers. They should be going around. I think Patty might have them yet. Give them a few minutes there. Did you hear anything from Mr. Kopish? No? Okay. And nothing? No. He had told me about a week ago he had some conflicts, so I didn't know if he had sent you anything. Okay. I should have thought of that. Should have said, well, what are you going to do? All right. Gerald, have you signed everything? Have you signed the vouchers? Not yet. Or you? Oh, you don't. I mean, did you sign them? Okay. We're just waiting for Patty. Just testing if you're listening, Gerald. Gotcha. All right. So the vouchers have gone around. What's your pleasure, folks? Mr. Warco has made a motion to approve.
Second that motion.
Mr. Barat is the end of the day, folks. Mr. Baratka has seconded. Are there any questions for Chris Ann at this time? Oh, she went and sat down already. I guess. Okay. Hearing and seeing none. All those in favor?
Aye.
Those opposed? Okay, they've carried. Thank you, Chris Ann. Okay. Committee appointments. We have Health and Human Services Board, Stacy Pomeroy, but she's not here at this minute. Here, I'll let you talk.
Stacy Pomeroy is going to fill the position on our board for being the nurse, because we need a nurse and a nurse practitioner. So Stacy, maybe in this way, maybe we got confusing because of talking about our 9 o'clock meetings, 4 o'clock, and today is a 4 o'clock and a 5 o'clock. So, but she is going to be appointed to our board.
Okay, she'll be a nice addition. That'll be good. And then we
Madam
also,
Chair,
yes,
just jumping back here, do we miss the minutes approval?
you know how many times? No, I thought we did that.
I think we did vouchers. Did we do the minutes?
Vouchers,
Or did I
no.
miss it? I
You know.
might have missed it.
No, you didn't.
Okay.
All right. Minutes have been, you had those in your packet. Now, I find it interesting we have the minutes for this meeting, but I cannot find the minutes for public participation of last year. So do you have them?
If I may, the minutes from the last public participation here were approved in the September regular Health and Human Services Board meeting.
Okay.
Yes.
Okay, thank you. Thank you very much. Okay, so we're just looking for the approval of the minutes of the July 8th meeting.
I'd make a motion to approve those minutes.
Mr. Brock has made the motion and seconded by Mr. Gerald Swenson. Any comments, any concerns, any discussion? Okay, seeing and hearing none. All those in favor? Those opposed? Okay, the minutes are approved and seconded. All right, so we have gone through Stacy Pomeroy. We're going to talk about the opioid committee update. We did have the meeting this at noon today, and I'm just going to give you a short synopsis because we didn't have, well, we do have some minutes here, but I haven't had a chance to look through them. So I'm going to look at my agenda that we had It was pretty short, pretty cut and dried. We had public comments and communications, none. We had minutes. We looked at the discussion and recommendations from last month's opioid funding, and we had, everyone should have that sheet in front of you. I don't know where mine went. Do you have that sheet? You want to just hold it up so they know? So that's the sheet. And on there, it talks about the different fundings that we're looking at. And this will come to our meeting next month for approval. So you'll get time to look at that. We have these monies from the opioid that we're going to, well, Nick, why don't you explain it real quickly for everybody?
I don't know what you know or don't know, but so we had an opioid committee that, because we were receiving funds through a settlement, and we'll be receiving those funds for several years. We currently have about $285,000 that we've received. We'll continue to receive a small portion. It's not like that we're going to get that amount each year. The committee has met 4 times out of the 5 allotted. Today at their 4th meeting, they said, here's what we've been or we presented this list as, here's what we've been talking about. Does this sound good to the committee? And do you want a motion to send it to the Health and Human Services Board, which at the next Health and Human Services Board, they would have to do a resolution to send out that, or to use that funding or that money. And that would have to be approved by the board. What you have in front of you is a 3-year plan. Obviously, at the 4th year, we'll still be getting a small portion. It's less than $15,000 a year after that. At that point, the Health and Human Services Board could just allocate that remaining money each year to programs. Any questions?
This is mostly an FYI right now because we'll have more discussion at our next meeting and at that time. So we just wanted you to have this in your hands so you have time to look at it. You can write questions to yourself so that you can bring them back to our meeting next month. Okay? All right, we'll move on then. And we'll go on to the annual report. I'm going to pass that on to Sarah.
Okay, Carrie had passed out the annual report, and I know that you've just received it now, but what I would like you guys to do is review it. And then in September, we will have the managers come in, and if you have questions in regards to any portion of the units and their stats, they will be able to answer that for you in September.
Okay, thank you, Sarah. And again, another FYI. So we'll move on to the Public Health Unit, Tiffany Polachek.
Hi, back in July, Public Health completed our 140 review. What the 140 review is, we have a state team come in and make sure that we are following state statutes, which are required of a level 2 health department. It's usually done every 5 years. Our last one is actually done in 2023. So it was only 3 years ago. And the reason that is the state had reached out to local health departments asking if anybody would want to bump up, because during all of the COVID stuff, everything kind of got jumbled up and everybody ended up on the same timeline. So it was a little bit difficult for them to see multiple counties in 1 year. So we did put our hand up and say, we'll go early, and they bumped us up 2 years instead of 1. So, which was fine. So during that 140, they look at everything from how we are doing communicable disease control, how we do emergency preparedness, our health promotion. We brought in some of our nursing staff, gave updates on what we do. We have got some really good feedback from the state. They said we are kind of a little hidden gem. They're very proud of the work that we do here at Price County, which, I mean, I can't say enough the work that the nurses in public health and all of our staff there, they work hard. They're a good team, and I'm really proud of them, to say the least. One of the other things that occurred during that day is we did have a recognition of somebody on our team. Amanda Kozak was recognized by the Office of Policy and Practice Alignment from DHS. for her help on the public health billing network. She was instrumental in helping a lot of health departments answer questions and making sure that they're meeting their needs of their clientele and hitting all of their grant requirements. She was received a thing of recognition, and then because Public Health and Price County Health and Human Services supported that, we received one as well. So I'll pass that around so everybody can see, but Amanda really is an invaluable member of our team. So it was really nice to see her recognized at a higher level. So we should be getting our final recommendations from the 140 group in the next upcoming months, and then they'll present that as to like a pass fail type of thing. And then but it sounded like everything went very well.
Nice. Okay, thank you, Tiffany. And congratulations to Amanda as well. That's okay. Number 8, Aging and Disability and Senior Services Unit, Chris Maybe.
Hello, everyone.
Hi there.
All right. So, I have the quarterly report for April, May, and June. You should have that in your packet. It's the colorful one. So I listed here, total meals served for April, May, and June. Total, all the sites, congregate and home delivered. 1,622, 1,445, and 1,611. So it fluctuates every month. May was down a little bit. Then at the bottom, I broke it out to show the number of congregate meals served each month at each site. So you can kind of see there, it looks like Brantwood serves the most congregate meals. Followed by Ogama, Kennon, Park Falls, and then Phillips. Any questions so far? Then on the back, average number of home delivered meals each month. Again, I broke it out by site. Park Falls has the highest amount, followed by Ogama, then Phillips. Brentwood and Kennon have about the same. Transportation program for those 3 months, they drove 11,763 miles, volunteered 412 hours. They provided 102 trips, and we had currently at that point 4 drivers. The senior site programming in April, technology assistance was offered by NTC in Ogama and Kennon. In May, the Prentice Choir and Band went to Ogama with approximately 22 meal site participants. At that time, the dementia care specialist provided brain games in both Kennon and Brantwood. A watch party for a free webinar was held at the Phillips site. Approximately 12 people in attendance. Again, technology assistance was offered by NTC in Brantwood. And there was an advanced planning discussion held in Ogama on the 29th with attorney Christy Spear, with approximately 15 attending that. The elder benefits specialist saw 54 clients in those 3 months. Any questions?
Yeah, just real quickly, under April, with your technology assistance, what kind of assistance were they providing?
I believe it's Kathy Shimkitz from NTC, and
Sure.
she provides like a phone, iPad, that kind of.
Oh, so were they aware of this so they could bring those devices
Mhm.
with them? Oh,
Yep.
nice. That's
Yep.
really nice.
Yeah, they visit throughout the year. She's got it scheduled every couple months. She'll go to each site, not Phillips and Park Falls, because she goes to the libraries there.
Oh, got it. Okay. Well, thank you.
Yep.
That's a good service.
All right, any more questions? Otherwise, we'll go on.
Go on, him.
The Nutrition Advisory Council met on July 30th at the First Presbyterian Church in Phillips. We introduced Beverly Hakenen as the new Brantwood representative and David Schmidt as the new Park Falls rep.
You use your microphone, Chris.
I just put it way back.
Thank you. I know.
Felt like I was eating it. Okay. Then Dave Schmidt was elected as the vice chairman for the committee. Updates, the Phillips Senior Dining site, a sub was hired there. It's actually Reggie Diston. She has been volunteering at the site for quite some time, so she was just recently hired as the site sub. 160 congregate and home delivered meal surveys were mailed out. That is mandatory by GWAR. So then I'll be looking at those and computing the results. The June 2026 meal site stats were reviewed. Meals served was 1,622 with an average of 91.5 per day. The site reports included Brantwood. They were overall happy with the meals. The request for more chocolate milk. Kennan, they requested the same. Otherwise, they did report that the meals have been good overall. Requesting more chocolate milk again for Ogama, and I have addressed that. So, Park Falls reported that the diners are overall happy and the meals are good and affordable. Phillips reported they're very happy with the meals as well. Our next date for the meeting will be October 29th at the Kennan site. Any questions?
Are there any questions for Chris? We kind of chuckle when we hear the things that they request. It's always an interesting what they want. You know, chocolate milk must be, like Mr. Brodka said, is a theme this week. Yeah, so good.
Sure was.
No questions at all. Okay, thank you. You'll also notice on there on aging and disability that we struck the Woodland Enhanced Health Service Commission and her Dawn Grizzle because that meeting is not until the end of this month. So that report will be on for next month. Number 9, well, actually, let's jump back up. I missed it under communications. Dawn and Shauna, if you'd like to come up and introduce the new employees that we have, please. Thought I was you were gonna get away with it, huh?
She's trying. She really wanted to get away with it. So this is Madeline or Maddie Bogard, and she has joined our team for children's waiver and comprehensive community services, and will also do crisis on call once all of the training is completed. She's probably bored out of her mind right now because that's literally all she's been doing. But we're excited to have her, and so this is Maddie.
Maddie, why don't you tell us about yourself?
I just graduated in May from UW River Falls with my bachelor's in psychology, and I'm currently doing an online program to get my master's in social work.
Well, good. We welcome you here.
Hello, I'd like to introduce Amy Trethaway Madsen. She is our new ADRC specialist. She started a little while ago because we missed her last time, so she started back in June. She's doing great. She has all of her training done and is starting to take phone calls and do walk-ins. And we're looking forward to her getting out and being able to start doing screens. So this is Amy.
On ahead, Amy.
Hi, I've been in the Phillips area about 3 years now. I'm originally from the UP of Michigan. I've never worked in this field before, but it's very near and dear to my heart, so I'm enjoying it.
Well, good. Welcome aboard.
Thank you.
Thank you. All right, now let's just jump back down over here, keeping you guys guessing here today. So we are going to go back down to children and youth, and Caleb Morgan, please.
It's going to be Jasmine.
Oh, it's Jasmine. That's right. Jasmine.
Desmond Marlinga, finance.
Yeah, we were kind of chuckling to ourselves here because we were trying to remember all of Jasmine's names. She's a Kleinhans, and then she's not a, her mother,
We did her mother-in-law.
mother-in-law's name, and then we did her name, and it's like, okay. Jasmine Marlenga. It's the trouble with living in a town, and we all know you from baby.
Yes, exactly. Yes, I'm Jasmine Marlinga. I'm the foster care coordinator here. So this is Chris and Dennis Connor, and as many of you know, they have been dedicated foster parents for Price County for 38 years.
Wow.
Fostering takes a lot of patience, resilience, and commitment, and we are all here today to remind you that your hard work did not go unseen. As I've talked about your years of service with different people, I've been asked a few times how many placements you've had over the years, so that prompted me to take a look. Since our statewide computer system went live in 1996, your family has had approximately 52 placements, and that does not include the placements you had in the 8 years prior to then. Just think of all the kids who felt safe because of your decision to open your home and offer love and care. Fostering for nearly 4 decades, you not only changed many hearts and helped many families who needed it most, but you also gave a huge gift to your community, and the impact will be long-lasting. On behalf of the department and the Board of Health and Human Services, I would like to present you with this plaque as a reminder of our gratitude for all you have done. Thank you, and please enjoy some cake as well. Here's
I'd also like to thank them. I've been with them since, well, I've been with the department contracted since '89. So I have been with them throughout the years. And I'll tell you, you don't know how many times we would say down the hall, we'd be looking for a placement. We'd go, we know Connors will take them. We know Connors will help us out. So your names have been up and down the Health and Human Services Children and Youth Hallway thousands and thousands of times. So I want to thank you for that dedication and the commitment you have done to foster parenting for us.
Even at 2:00 in the morning?
Even at 2:00 in the morning. Yep, you guys have all around the clock, 7 days a week, 24 hours a day. You guys have been very, very helpful. We really appreciate you guys.
I just want to say that I think we lasted as long as we did because we always felt supported, and you guys did a lot to help make it work too. So your agency was very helpful to us, and I can't say that that's the way it is everywhere. Well, thank you,
Chris.
It was an honor and a blessing, even though it was a little challenging, but it was still.
To say that we still say their name up and down the hall, even though they're there, like, I think they'll still take us.
If we could age backwards, we would retire.
So after the meeting, between our participation meeting, we'd like to invite everybody to help celebrate. And so we have cake for everyone to celebrate their dedication to our department.
2 huge hearts helping so many out there. So thank you again. But yes, please partake in some cake and maybe chat with the Connors a little bit. All right, economic support. Beth is here. There she is.
Sarah wanted me to come back and talk a little bit more about the food share error rate. So there are 4 steps to the quality control reviews that the state does to get this error rate. So first, state agencies randomly select a sample of households participating in SNAP in their state each month, a total of 50,000 cases nationwide each year. So state agencies staff interview participants and conduct a detailed examination of their household circumstances. So they need to complete an interview with the person, the head of the case that they select, and they request all types of verifications. They actually have to verify their shelter and utility rent expenses, send in statements where normally they don't have to do that just for our program itself. If someone does not participate in that review, they no longer are eligible for food share until they do qualify. So they can go 2 years without completing that review. They still need to complete that review before they can become eligible again. So the information is used to measure how accurate states determine the selected household's eligibility and benefit amounts. States calculate the number of errors, both overpayments and underpayments. So from there, if they find an error in the case, it gets sent back to the person who made the case to correct. We can dispute it if we don't agree with it. We have won some disputes in the past, so we do take them seriously and make sure we're doing it right and that they're doing their job right as well. So errors are corrected, overpayments must be repaid, and underpayments need to be reimbursed so each household is receiving the exact benefit that they were entitled to. From there, it goes to a federal review. So the USDA double checks the accuracy of approximately 25,000 cases reviewed by each state. The USDA validates that the state reviews were done properly with correct policy and procedure. If the review is inaccurate, the USDA changes the findings so it is correct or sends the case back to the state for further review. The goal is just to make sure we have accurate findings for our statistics. And then from there, the USDA analyzes the data, taking into consideration the size of each state's caseload and other variables. Based on that analysis, the USDA establishes the national and state payment error rate, which gets released each June, which goes back to what Sarah had discussed, I believe, at the last meeting. And the 2025 error rates came in, and the Northern Consortium was ranked number 9 in the nation. So we came in at 5.72% error rate, which is very good. And then the new error rates just came out about 2 weeks ago, and we are at a 6.57%. But the Northern Consortium had a perfect score with 0 findings, which is good. We do have protocols in place because of the error rate increasing. So we have like a pre-certification review tool that we use where cases that meet certain criteria have to be reviewed by certain workers before they can be confirmed to ensure that the correct benefits are going out.
Okay. Well, I'm sorry, Mr. Kopish missed that, but he asked for this. So some clarification. So thank you, Beth. We'll tell him that you did a great job. Actually, you might want to save some of that information. He might, or maybe pass it on to him or whatever. Sure, you could do that. Okay. Okay, Fiscal and Administrative Unit, Carrie Hammond. It did. Because Mr. Kopish isn't here.
Okay, so we have our high cost placement report in front of you. You know, they're running a little bit high, especially in the children and youth unit. But that was kind of to be expected, and kind of told you about some of those things that were going to be upcoming that are just a little bit out of our control. But Carrie and I have been reviewing the high cost placements in detail. And we're, like we kind of discussed, we're working on creating a little bit more of a comprehensive report that will show you a clearer picture of some of these expenses and then some of the revenues that also come in, just so you can kind of get that full circle piece of that. So we look forward to sharing that with you. Hopefully next month we'll have it done. We just want to make sure that we do it right. So,
okay.
Any questions?
Thank you. We'll look forward to that. And then we'll pass it over to our director, Sarah Reese Soha.
One is I want to let you know that I attended the 140 review for public health, and it was an extremely glowing report. Actually, one of the ones that were doing the interviews there asked if she could even work at Price County. So she was very excited about how creative our workers are. So that was a really fun review. It was very nerve-wracking though too, because there's 4 state people there taking notes, and it's pretty intimidating. So they did a great job. A reminder, our orientation is on September 9th. It's starting at 1. I know that Meredith had sent something out, I believe, to the whole county board. So if you see somebody that's interested, please let me know.
They can come before.
Absolutely. Yep. If you come, you can come again. Absolutely. And then for our personnel, we are advertising for an economic support specialist, and that closes on August 19th. And then behavioral health, we had interviews. We've hired Madeline, who was here, and we have 2 positions that are still open. That's
Okay, looking at the agenda, I don't think I've missed anything more. Nope. All right. And with that, this meeting is adjourned. Thank you for being here, and please make sure you stay and enjoy a little taste of cake there and give your congratulations to the Connors. I think a picture is necessary for this. This is a historical. It's okay. Tear-stained faces are just fine. This is a perfect place. So thank you all for being here. We will have the public, excuse me, the public participation hearing at 5 o'clock. So we will be back